Yeah, so what we looked at is EMBARK, just as a quick reminder, was a global phase 3 trial of patients with high risk, non-metastatic biochemical recurrence. So all failed surgery or radiation. And what we, they were randomized to either enzalutamide plus ADT, enzalutamide combination, ADT alone, or enzalutamide alone. And we previously reported that the enzalutamide arms, either with or without ADT, significantly improved metastasis-free survival. Metastasis or death went down with the enzalutamide therapies. And a really unique aspect of EMBARK is that we measured PSA in that 36 weeks. If it was less than 0.2, we actually stopped the treatment. So actually got a treatment suspension and then would go back on to therapy when the PSA hit predefined thresholds. And so the question here we wanted to understand is, how did going off therapy impact the quality of life? And what we saw is globally, a little bit to our surprise, but it kind of makes sense of when we stopped and thought about it, is actually quality of life didn't change going off the treatment. We looked at pain, the global quality of life, a lot of different measures didn't really change. And we kind of thought like, hey, it would bounce back, everything would be great. And we went back and looked at it and thought about it. What we saw is actually up front that going on the therapy in the first place didn't worsen quality of life. So if you're on a treatment that doesn't impact your quality of life negatively, when I stop it, your quality of life is not going to get better because it wasn't impacted in the first place. The one thing that we certainly know that these therapies, all these therapies, has hormonal related symptoms, flashes, other things we see. And so when we did see, that is the one metric that did improve really rapidly across all 3 arms. Within 12 weeks of stopping therapy, we saw significant improvement in hormonal symptoms. So I think it gives us confidence that we have therapies, new options for patients that can delay the metastasis, the time to metastasis and maybe survival, and without impacting negatively quality of life. So it's a really important message for physicians and to relay to patients.